Hi FreeBody Massage family, welcome back to the channel. This is the FreeBody Massage channel where we help you understand the body, understand pain, and give you skills and tools that help you help your clients so that you can be the best massage therapist that you want to be and that you can really serve your clients with fabulous techniques and skills. So I'm Kat Matlock here at the FreeBody Clinic and Studios in Asheville, North Carolina. And today I wanted to get real specific with an area of the back that is a part of the erector spinae bundles. So not only just the erector spinae in general, and I did a video on treating the erector spinae. We're gonna put that link in the description for you so you can find that really easily. And I also did a video on some really delicious back warm-up techniques. You'll wanna do some of that before you get into this real specific treatment. We'll put a link in the description to that in case you missed that video also. So now this iliocostalis trigger point can become really a pain for a lot of people. So it's part of the erector spinae bundles, and the erector spinae have the task of holding the spine upright. So there are back bending muscles or just keeping us upright, you know? So if you have clients who tend to slouch a lot or bend over a lot like their massage therapists like we are, or that they are holding children or picking up kids, or they spend a lot of their time rounded forward, maybe leaning over a desk all day, these upper erectors, the whole erector lines actually can get really fraught with tension and trigger points, and they can also get really weak. Their fascial bags get a little thin. That's when danger of tearing and pulling really happens. I have noticed, and you'll hear me talk about this in the treatment video, that this area between the shoulder blade and the spine, toward the bottom portion of the shoulder blade, between the shoulder blade and the spine, this iliocostalis really wreaks a lot of havoc in a lot of bodies that come to see me on my table. And this pain tends to radiate downward. You can see in this picture that we're putting here, and the muscle as well. See how that drops? It can go all the way down to the low back, even into the pelvis, but kind of covers, just can feel to your client like a line of tension all the way from right next to the shoulder blade all the way down to the pelvis. Why is that? Iliocostalis, the name means from the pelvis through the ribs. Ilio is ilium, pelvis, costal, that's ribs. Iliocostalis is a muscle that spans that huge expanse from the pelvis up to the rib cage and through the rib cage, and it gets really sticky right next to the shoulder blade. So a lot of folks will come in and go, I just have this, they can't even reach it. Yeah, I have this spot right back here. It's really aggravating me, and it aches all the way down. So then you know, oh yeah. And even if they don't say that to you, you'll feel it. You can find this point, and you'll keep them from having that pain in the future. So get psyched. Your clients are gonna love this work. I really hope this serves you. Please drop a comment below if you learned something from this video. Tell us what you learned. Tell us what you need help with. I'm happy to make a video just for you. Check out those links in the description. Kat here, and I'll see you in the next video. Releasing iliocostalis, upper point by the scapula. So one of the most common complaints I get and most common points in the body is right here, this right medial to the shoulder blade, iliocostalis. And what's really fascinating to me is that it almost always shows up in the left side of the body more than the right. And so I have some theories about it, because more people are right-handed than left, and we use the two sides of our bodies very differently. I just think that it just has to do with the way that we use the left side of the body as opposed to the right side of the body. So as we come up and palpate along that medial scapula area, and we're off the scapula, I'm not on the shoulder blade at all right now, and I find this little line, and so we can almost even see the trapezius coming up there,
And the trapezius just moves pretty much right out of the way. But then we've got deep to that, this section of iliocostalis, and we can follow it down. Notice, see how wide that is? Like iliocostalis is wider than you might think. And so we could kind of strum along there, glide down. The easiest place to locate that is right near the shoulder blade. Here's my inferior angle of the scapula. And I ride up along, and rhomboids begin about a third of the way up and then angle like a chevron toward the spine. And so right near that inferior angle is I can put my flat thumbs and start to drag across. And I'm going to run over a speed bump. And that speed bump there, this is iliocostalis tissue. This is one of those erector bundles. And usually along this area, there's a real tender spot. So I'm just going to check in with my client. I can follow that all the way up. See that clunk clunk that happened? That's rhomboids. That's when, because I'm getting through many different layers. By the time I get up here, what have we got up here? We got erectors, we got rhomboids, we got trapezius. So there's several different lines of tissue. So I want to stay a little bit down lower by the inferior angle. And it's usually pretty close in. So I can feel this line of tissue right here. So I'm going to get real specific. And I'm going to turn my thumbs down. I'm going to bring this table down a little bit so I can take care of my body a little bit better. And I'm just going to palpate. I'm going to just check and see. Erin, is there a tender spot there?
A little bit.
And there may not be. Yep, that's fine. So I'm just going to keep walking up.
There is one. I felt it, but...
Up a little higher. Ooh, that's going to be a good spot, I think. Or it's just thick. Like sometimes places where I might think there's going to be, it's just because layers of tissue are there, right? So we can't always feel it. And so I'm coming up a little higher.
That's pretty sensitive.
And that's sensitive. That's a tender spot right there. So, and how is that pressure? Do you want more or less?
You do a little bit more.
A little bit more. So a little bit more means that I'm just going to stand over and I'm going to sink my body weight in a little bit more. Whoop. And that got real exciting. That got real exciting after that moment. And then, Erin, I'd just like you to let me know when that feels a little easier, a little bit better. I'm just using a supported thumb. Just one thumb right there. See how close I am to the shoulder blade? It's almost always where that little point lives. Starting to get a little easier. We'll just encourage her to take a nice deep breath. Great. And then we're going to back out. It's just a really common spot right there near that intersection of the shoulder blade. And so I just want to check through that tissue. Here I can find another little rope right here. And that's more longissimus. If I come out a little wider, here's iliocostalis. So here I'm just in ribs. It's really the flat of latissimus actually covering up this area. There's no ropes going up and down. The first rope I bump into is iliocostalis. The second rope, where I usually do my 1, 2, 3, that's longissimus. And then up through the central area here, little tiny thin rope is spinalis. I just want to use my elbow a little bit more. This tissue is very thin. So, you know, often when someone says to me they want deep work, what I say is what you want is specific work. You want to feel it, and I get that. But some tissue is really superficial. It doesn't need to be deep. It just needs to be specific. And so I'm just going to slowly drag my elbow point along here. And Erin, I'd like you to let me know if there's any place along here you want me to stop.
Right there, maybe? Yeah.
I'm going to sink in a little bit. And that's often a good way to explore, because especially early in your massage career, it will be difficult to feel the difference between like going over a rib, going over bundles of tissue that are layered with other tissues, and actually feeling where a trigger point is. And as I've mentioned before, we can't always feel it. We just can't always feel it.
Feels great. Feels very loose.
Feels loose, great. And then I'm just going to continue to glide down. We've got just a little bit longer, a little bit further in that iliocostalis. And again, if she wanted more pressure, which she didn't ask for, so I'm not going to do it, but if she wanted more, I would just bend my elbow more. I'd just bring my hand closer to my shoulder, and that would drive my elbow point into that tissue. And then I just do some nice soothing with my other hand. Great. And that's our iliocostalis. And I just want to check and see if she has this point on this side. And drag my thumbs across. I kind of lay down. I'm lower than the scapula, that inferior angle. I'm going to slide across. And that first kind of ropiness is iliocostalis. And we'll follow that up. It often just gets real kind of thick and sticky right around this area. And here it got even a little chunky. How about right there? I'm going to lay my elbow in. You can let me know if I'm in a good spot, okay? I'm going to lay my elbow down. I'm going to lean my body weight into it. Good spot, yeah. And it's just usually about an inch or so up, and of course everyone's anatomy is different, along that vertebral border of the scapula. And up from the inferior angle of the scapula. Nice. Take a nice big breath in your belly, Erin. Belly gets really big. And then as you exhale, just sinking your whole body down into the earth. Nice. Great. Catch up there, yep. And I can see your right shoulder sits a bit higher. And so it looks like that it's, and you can probably see in the camera that the right shoulder is just a little bit closer to her ear than the left one. So that catch is probably more about levator scapula than it is about an erector. But let's see, let's just give a little glide. Because it is erectors all the way up. So as I kind of wiggle across, as I bump right next to that shoulder blade, how's that? Really good. So this is such a good point about everything is relative to everything else. Nothing works in a vacuum in life or in your body. So one muscle shifting its tensional balance is going to affect other muscles and the other muscles. And so now that we've been releasing through her erectors, some of the other tissues are going, hey, what about me, right? And so really the best massage, the best treatment you can give is that you follow the tension and you listen to your client. And you ask them, sometimes I'll ask, like, or I'll follow it. Oh, if I feel like I want to work up here. Oh, I feel like this. When my client says, oh, there's something now up here, I'm going to go, okay, let me put my elbow in that, see what we can do, right? And so I'm going to kind of wiggle along here. And just because I know, yep. And I'm going to sink right in. And I'm right now, I'm closer into spinalis, or this could be trapezius. And because I'm using my elbow, I don't have the same sensitivity as my fingers. I can't really tell what layer of tissue I'm in, but I could feel that it was thick. And that thickness can indicate that there's a trigger point there. And so notice the open elbow. I didn't have to bring my hand up toward my shoulder much. The angle is good here. I'm 90 degrees to the tissue. And it's just starting to soften. And we'll just let her take another breath or so here. Beautiful. And then before I drag anymore, I want to soften my pressure. I either want to lift my body up out of it, or I want to drop my hand so that my elbow point is not dragging into that tissue anymore, right? I don't want to drag with a ton of pressure in that tissue. Because the thing is, the whole line of the erectors, any of those erector bundles is not going to need the full attention. And we just follow along. We follow our clients' bodies. We palpate, we feel in. Spinalis is really close to the spine here. It feels like right here on this left side now. It's a little bit stickier. So I'm just going to place a thumb. Here's the spine right here. I'm going to place a thumb, straight arm, and I'm going to sink my body weight in. And how about there, Erin? Is there something tender there?
Oh, yeah.
She said, oh, yeah. And what did I feel? I just felt that it was thick. And it was thicker relative to the opposite side. I had my two thumbs going along here. I could feel this left side was thicker there than the right. And this is the area of spinalis. She said it's a hot spot on that side sometimes. And that makes sense. Especially because, you know, one of the things we talked about was that as this lower section of the erectors on the right side is a little wonky, the upper left side will often kind of counter to try to counterbalance. And you know, now we're up in this upper thorax. We're starting to get into semispinalis. And you know, these posterior cervical semispinalis splenius muscles, they're all erector muscles. They're all erectors. And then we just drag. And we don't want to glide with our strongest pressure. And then we just do something a little nice every once in a while, a little soothing, like, whoo, good job, that was great. So iliocostalis, longissimus, spinalis, those three lines of the erectors. so many different places where they can get stuck and sticky. And the tension in those muscles, the trigger points, their pain referrals, especially from about shoulder blades down, they tend to refer down. And even this one up here by that medial scapula often just refers down. That one can refer all the way down. It can feel like a line of tension, a line of aching all the way down. These middle lower thorax points can refer even as far down as right next to the sacrum at the SI joint, or even into the low back. And then I always finish a little treatment of those erectors with some nice soothing, just like I began. Just as I began, I'm going to get some oil, I'm going to get it on the body, I'm going to glide. Great. Great. And that is treating iliocostalis and just doing some awesome back work.